Thank you. Your Excellency, the fourth President of the Republic of Kenya, Ministers of Health in East Africa and beyond, WHO representative, country representative, Africa CDC Director, Deputy Director General, all protocols observed. Good morning. So, Your Excellency, the importance of global health security. Global health security is really critical for safeguarding the well-being of populations and economy, especially in the face of emerging and re-emerging health threats. We have learned a lot of lessons from the COVID-19 pandemic, which has emphasized the need for preparedness, innovations, and regional collaborations. Again, in Africa, we've had multiple emerging, re-emerging infectious diseases, antimicrobial resistance, as well as climate change, which all have had a united approach across borders to ensure health resilience. What are Kenya's efforts in strengthening health security? We have invested in modern healthcare infrastructure to respond to emergencies. Again, we've had commitment to regional collaborations where we've had knowledge, experience sharing sessions, best practices, resources within the neighboring countries to support this. Again, we have focused on capacity building sessions with support from, again, partners like Africa, CDC, WHO, among others in matters global health security. And we also thank the University of Nebraska, which will be supporting us through AMREF, KEMRI, and again NPHI to improve capacity building session. Equally, we've had public-private partnerships which are fostering innovation and mobilizing resources. We've seen in the Expo Safaricom with their digital health, and so we are working again with the partners, and again empowering communities through initiatives like the community health promoters. Again, critical is the UHC. Your Excellency, as you are aware, even during your government, there were a lot of discussions and piloting in matters UHC, which is really part of the SDG 3 goal. And so as Kenya being the big brother of Africa, we are looking to be pioneers in UHC and again be best practice in Africa and beyond in matters affordable, accessible, quality care through the Taifa Care. So the summit's role is anchored on the theme of securing health and prosperity, one community at a time. And this theme has been broken down into 3 sub-themes to guide conversations each day. Day 1, we talked about the whole of community approach, which emphasized the collaboration efforts required for health security involving all sectors of the community. And in day 2 today, we are talking about building resilient health systems. Centers, the day will be around improving health systems, a vital area for achieving effective health security. And again, we hope to talk about UHC during this time. And in day 3, we'll talk about building sustainable preparedness, that is emphasized in importance of long-term preparedness strategies for future health security and challenges. So the key highlights following yesterday's discussions. Yesterday we set the tone for the summit, outlining objectives and stressing the significance of advancing regional health security. There was a leadership commitment to advancing health security in the region and discussions on regional health security priorities, and we reflected on lessons learned during COVID-19, what went well, what went less well, among other outbreaks, and emphasized on building resilient communities during this. There were also discussions on the role of private sector, discussions on the role of the National Public Health Institute, which is critical for better pandemic preparedness and sustainability. Again, discussions on biosecurity and bioterrorism in East Africa. There were conversations on big data and AI in healthcare, and discussions on the role, transformative role of data and AI, which is now currently one of the big agendas where we are rolling out digital health. We hope to have 100% digitalization of our health system in Kenya. Equally, we had sessions on academia and research, which highlighted the importance of academic institutions in fostering innovations and building capacity in health security. And so this summit serves as a call of action on health security, urging partners to move beyond discussions and turn towards commitments into tangible actions for a healthier, more resilient region. And so my pleasure to welcome you, Your Excellency, to address the people. Thank you.